Hello, everyone. I am Harry, your host. If you rely on Social Security in any way, whether for retirement, disability, or Medicare, there are changes happening right now that you need to understand. New rules, staffing cuts, and system changes are overlapping, and if you're not prepared, you could face delays, missed paperwork, or real trouble accessing benefits you count on. Some updates may help protect the system, while others can quietly make simple tasks harder if you don't know what to expect. That's why this matters today, not later. Before we go further, let me ask you something simple. When you think about Social Security right now, do you feel mostly calm or mostly uneasy? Let me know in the comments. I'm genuinely curious. So here's where things start to get complicated, but I'll keep this simple. Social Security isn't just one program. It's a massive operation that serves about 74 million Americans. That includes retirees, people with disabilities, survivors, and folks signing up for Medicare. Every month, millions of payments go out, millions of questions come in, and millions of records have to stay accurate. For a long time, that machine ran quietly in the background. You didn't think about it unless you needed it. Now, a lot more people are thinking about it because the machine is showing signs of strain. Since President Donald Trump began his second term in 2025, the Social Security Administration has gone through rapid changes. The administration partnered closely with the Department of Government Efficiency, often called DOGE, led by Elon Musk. The stated goal was pretty straightforward: reduce waste, modernize systems, and crack down on fraud. On paper, those goals sound reasonable. Most people agree that government systems should be efficient and secure. The trouble is how fast and how aggressively these changes were rolled out. Nearly 7,000 Social Security employees left the agency in a short period of time. That's about 12% of the entire workforce. Some were laid off, others took buyouts or early retirement, and here's the thing, these weren't just entry-level workers. Many of them had decades of experience. They knew the rules, the exceptions, the odd cases that don't fit neatly into a computer system. When they left, that knowledge walked out the door with them. At the same time, demand didn't slow down. In fact, it increased. Baby boomers are retiring in large numbers. Disability claims are complex, and Medicare enrollment isn't getting any simpler. So, you ended up with fewer workers handling more cases. And that's where the backlogs started piling up. Internal documents showed as many as 6 million pending cases in processing centers and around 12 million unfinished transactions in field offices. Those numbers aren't abstract. They represent real people waiting. Now, maybe you've heard about the long phone wait times. At one point earlier this year, the average wait was about 2 and 1/2 hours. That's not a typo. People would call, put the phone down, make lunch, come back, and still be waiting. Management responded by pulling workers from other departments and putting them on the phones. The problem was, many of those workers didn't get much training. Some employees described it as being told to just figure it out. That helped bring the average wait time down on paper, but it created new problems elsewhere. You see, when someone spends all day answering phones, they aren't processing claims, updating records, or reviewing documents. So the calls got answered a bit faster, but the actual work backed up even more. One union leader summed it up simply: that word piles up, and once it piles up, it doesn't magically disappear. Another major change involved fraud prevention. Again, the goal sounds reasonable. Nobody wants benefits stolen, but the way it was implemented caught a lot of people off guard. Certain actions, like changing direct deposit information, can no longer be done over the phone. In many cases, you have to do it online or in person with stricter identity checks. That's fine if you're comfortable with computers, have reliable internet, and can easily travel. But for many seniors and people with disabilities, that's a tall order. There was one case that really stuck with me. A 75-year-old man had suffered a massive stroke and couldn't drive anymore. He changed banks and needed to update his deposit information. He couldn't go online and he couldn't get to an office. The employee on the phone wanted to help him, but under the new rules, her hands were tied. She ended up telling him to ask a relative or call his bank instead. You can hear the frustration in stories like that on both sides of the line, and this isn't rare. Field offices have been crowded, appointments are hard to get, and people are often told to come back weeks later. Some folks show up because the website didn't work for them or because they didn't understand the online system, only to find out they still can't resolve their issue that day. Imagine being close to a deadline, maybe for a driver's license or medical coverage, and being told to wait again. Leadership instability hasn't helped. In a 6-month span, the agency went through 3 acting commissioners. Policies were rolled out, reversed, and then adjusted again. Regional offices were eliminated in a rush. Employees were reassigned repeatedly. One former acting commissioner even admitted that he flipped the switch knowing there would be casualties and described the agency as being subject to political whims. The kind of uncertainty makes it hard for any organization to function smoothly. Eventually, a permanent commissioner, Frank Besignano, was confirmed. He authorized overtime and emergency measures to deal with the backlog. The agency says it has reduced processing delays by about 1 million cases and cut disability backlogs significantly. That's real progress, and it's worth acknowledging. At the same time, independent audits showed that some of the improved phone statistics were misleading. Calls counted as having 0 wait time often involved callbacks that took an hour or more. So, the experience didn't always match the numbers, and public reaction has been intense. And honestly, that makes sense. Social Security isn't just a policy debate. It's rent money. It's groceries. It's whether someone can afford their medication. People talk about spending entire mornings on hold, about kind but overwhelmed employees apologizing for delays they can't control. Some are angry, others are scared, and many are just tired. There's also a political divide in how people interpret what's happening. Critics argue that the agency has been weakened on purpose, that cutting staff and pushing everything online makes the system less accessible, especially for the most vulnerable. They worry this is a step toward shrinking the program further down the road. Supporters of the administration counter that modernization is overdue, that fraud has to be addressed, and that short-term pain is unavoidable if the system is going to survive long-term. They see this as a necessary reset. And geography plays a role too. If you live in a rural area and your nearest field office is hours away, in-person requirements aren't just inconvenient, they're a barrier. Some people rely on neighbors for rides or simply give up. That's a very different experience than someone who lives 10 minutes from an office and uses a smartphone daily. What worries many people the most is trust. Social Security is built on a long-term promise. You pay in for decades expecting that the rules will be clear and the system will be there when you need it. When policies change quickly, when guidance shifts, that trust erodes. And once trust is gone, it's hard to rebuild. Now, I don't want this to sound like everything is falling apart tomorrow. Checks are still going out, benefits haven't stopped, but the friction has increased, and that friction shows up at the worst possible times when people are already dealing with health issues, retirement transitions, or financial stress. So, what does this mean for you right now? First, it means staying informed matters more than ever. If you're approaching retirement or helping a family member, don't wait until the last minute. Second, document everything. Keep records, confirmation numbers, and copies. And third, if something feels off, don't assume it will fix itself quickly. Follow up. Even though that's frustrating to hear, what I'll show you next might surprise you. And that's this. Despite all the turmoil, most of the people inside Social Security still care deeply about helping. Many of the delays aren't because of indifference, but because the system they're working in is stretched thin. Remembering that doesn't fix the problem, but it can help explain why things feel the way they do. So, stepping back for a moment, the big picture is complicated. The administration's goals, efficiency, modernization, fraud prevention are real goals, but the execution has created real pain for real people. Whether this leads to a stronger, more accessible system or one that feels distant and harder to navigate depends on what happens next. And if you haven't shared your thoughts yet, feel free to add to the earlier discussion. Hearing how others are feeling really helps put this into perspective. This moment matters so much, and why paying attention now can make a difference later.